knowing how health visiting works, it starts at the beginning of a new life. It starts antenatally, where obviously the health visitors complete a family health needs assessment, and we're looking closely at how we can improve that child and family's outcome.
But we had all leaflets, and obviously we could give them as much information as we could.
This is a very efficient, economic, effective way of delivering healthcare right at the point of need. But if you look at it in economic terms and impact terms and outcome terms, I think this is a terrific benefit for the system, and I think actually if you're of the right mindset, it'd be a terrifically rewarding career.
The difference we can make in the early years will improve that child's life outcome, and therefore improve their ambition in life and their drive, and therefore the futures of that child and family will be less of a burden on social care and housing.
Because I work within a community and I see health needs in a community, and I know that I can do something about it. And that gives you a sense of achievement, knowing that you can improve the health of the community. You can see families that would have struggled endlessly without your support. And when you see them walking through the doors with a smile on their face, and the children running through the door, and mummy bending down to kiss and hug that child, and you see that positiveness as soon as they walk through that door with smiles on their faces, then yeah, it makes you feel very proud. Abigail, are you smiling?
We did home visits, and there were common themes that ran through these visits, but all of the individual issues were different. But the advice that was given across 10 different visits was around health and well-being, around social service provision, around benefit rights. There were some hard messages delivered, some nutritional messages delivered, some prescriptions written. And when I actually saw the breadth of the advice that they offer and the expertise they have to draw upon, of course I was very impressed.
The integral part is for the health visiting team to work in partnership with the Children's Centre staff to identify those families earlier on that have a specific need that we can address together.
Prevention is better than cure, and prevention is a much more cost-effective way of dealing with problems at an early stage than waiting for them to build up, accumulate, multiply, when it's going to be a much trickier problem to solve and a much more expensive problem to solve.
You might have a clinic like we've done this morning. You may have developmental reviews, which are in a clinic as well. That may take up a morning. New birth visits, 6-week visits, and then you have all your visits in between that. That might be support visits. There's lots of meetings and lots of discussions with the family to keep them up to date with what the services are doing, and letting the families choose what they would like as well, because their voice is just as important.
If it's right for you, I can't think of a more rewarding role to do. I think it's a role that perhaps isn't appreciated as wide as it might be. So there's something about building on the awareness, letting people know the great things you do, and I can think of no better place to apply your trade. So I would encourage them to apply.